I'm Bridget, and this is part 3 of our presentation of the evaluation of traumatic brain injury. So I'm just going to go over the discussion. So all of the thoughtful questions that you all posted and the ones that were most relevant to our case. So the first question is, would it be significant to have multiple therapy sessions during the week for someone with a TBI? So, with traumatic brain injury being as complicated as it is, it really just depends on the client and what their wants and needs are. So, I just grabbed this from ASHA. It showed that treatment of individuals with TBI is individualized and typically considers the influence of the following things. One thing I wanted to point out was it depends on like if they have fatigue, limited physical endurance, and if they're really tired and not doing well after their injury. Meeting with a speech therapist multiple times a week is not going to probably benefit them. Whereas someone who is very motivated and really wants to be going to therapy multiple times a week, that might benefit them more. It's really individualized. Another question was, what impact does a solid support system have on recovery? So support system is very important with recovering from a traumatic brain injury. So research shows that one of the few things known about good recovery is that patients with a healthy support system do better. Whether it's friendships, family, self-help groups, maybe even a large group with other people that have traumatic brain injuries, just having those people to talk to and people that support you will help your recovery. Another question is the patient's prognosis more favorable because of the increase of the GCS the next day? And also, given his GCS score of 8 to 12, did his injury go from severe to mild? So first of all, the GCS score is the Glasgow Coma Scale, and it's used to describe the level of consciousness in a person following a traumatic brain injury. So what we know from the case is that when he was admitted to the hospital, he had a coma score of 8. So he was in a coma. And then 2 days post-admission, he was rated a 12. So he was more responsive at this time. The findings in each component of the scale and the sum score both relate to prognosis. So the higher the score, the better prognosis. So in this case, he would have a better prognosis. As far as the severity goes, it's kind of unclear because we don't have all the details, but a score of 8 would be considered a severe TBI, where a score of 12 would be mild. But then again, we don't know everything from the case. So what qualifies a TBI to be considered mild, moderate, or severe? So this was shown earlier in the presentation. It really just depends on the structural imaging of the brain, the loss of consciousness, the AOC, which is alteration of consciousness, the PTA, so the post-traumatic amnesia, and then the Glasgow Coma Scale. So all these factors put together will determine the severity. In this case, we don't know very many details. We know that there was abnormal structural imaging, and his Glasgow Coma Scale was an 8. So at the time of his traumatic brain injury, they would put him as a severe. And I did just want to go back to this question. So alcohol, that might have played a role in his GCS score. So if he was consuming a lot of alcohol, he could be unconscious from the alcohol and maybe not from the TBI. So it could give maybe an inaccurate score of that. What are the signs and symptoms for someone who has acquired a TBI? According to the Mayo Clinic, traumatic brain injury can have a wide-ranging physical and psychological effects. Some signs or symptoms may appear immediately after the traumatic event, while others may appear days or weeks later. So there are physical, cognitive, or mental, and sensory symptoms. So the physical symptoms might include the loss of consciousness, headache, nausea, vomiting, difficulty sleeping, dizziness. The cognitive symptoms might be memory, mood, depression, concentration problems. And the sensory might be like blurred vision, ringing in the ears, sensitivity to light. But with everyone's traumatic brain injury, really could be, they could have different symptoms. So everyone's very individualized. Some might have this, while others might not have that. So can alcohol play a factor in the severity of the TBI? We found a study done in 2010. The article is called "The Influence of Alcohol on Mortality and Traumatic Brain Injury." They stated that alcohol contributes substantially to the morbidity and mortality of trauma patients, regardless of the type of injury suffered. Serum alcohol levels correlate closely with the extent of injury. So alcohol intoxication was involved in 32% of fatal motor vehicle crashes in the U.S. Approximately half of those alcohol-related deaths and trauma occur in pre-hospital settings. Specifically in TBI, 35 to 81% of the injured patients are alcohol intoxicated, and 42% of the patients were heavy drinkers before the injury. So what they did in this study was they used rats, and they found that increased brain edema and negative effects on neurobehavioral function have been described in TBI rats receiving higher doses of alcohol as opposed to TBI rats without alcohol. So alcohol is definitely not going to help your brain, even without a traumatic brain injury. And there are our references. Thank you.